Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Azizah Amri. I'm from Makassar State University in English Department, Language and Literature Faculty. My registration number is 115204127. Okay, here I want to explain you about psycholinguistic. Psycholinguistic uh, about language disorders. Uh, this topic I want to explain you about two parts. The first is um, thought disorders and social anxiety disorders. Okay, uh, the first is thought disorders. There are three parts of thought disorders. The first is senile or dementia. The second is schizophrenia. The third is depression. Okay, the first is senile or dementia. Dementia is not a single disease in itself, but the symptoms such as impairments to memory, communication, and thinking. Dementia is a decline in memory function. It's getting worse from day to day. The next is all dementias are caused by brain cell death and neurodegenerative disease. It is progressive brain cell death that happens over a course of time is behind most dementias. But as well as progressive brain cell death like that seen in Alzheimer's disease. Dementia can be caused by a head injury and then neurodegenerative disease. Neurodegenerative disease, it is like Alzheimer disease. Do you know Alzheimer is the most common form of dementia, a general term for memory loss and other intellectual abilities serious and enough to interface with daily life. And then dementia can also be caused by brain tumors, stroke, depression, HIV infection, and reversible factors. Here, reversible factors, some dementias can be treated by reversing the effect of underlying causes, including mediation interaction, depression, vitamins deficiencies, for example, thiamine B1, leading to Wernicke-Korsakoff syndrome, which is most often caused by alcohol misuse and thyroid abnormalities. And then the next is schizophrenia. Schizophrenia is a chronic, severe, and disabling brain disorder. The next is schizophrenia always utter word salad fluently. Do you know what is word salad? Here word salad like for example someone saying one sentence and the next sentence in the next sentence it is not relevant with the two sentences. It does not have relationship. It does not have a meaning. There are no meaning between one sentences and the next sentences. It is like word salad, and people with schizophrenia always saying word salad with fluently. And then People with schizophrenia, the first is may hear voices other people don't hear, or they may believe that others are reading their mind. The next is controlling their thoughts or plotting to harm them. These experiences are terrifying and can cause fearfulness, withdrawal, or extreme agitation. Um, it means that people with schizophrenia always got hallucination with their self. Hallucination in here is hearing voices is much more common than seeing, feeling, tasting, or smelling things which are not there but seems very real to the patient. It is very real for them, but actually it is not. It is nothing. And then um, people with schizophrenia, uh, they may not make sense when they talk, and then they may sit for hours without moving or talking much. They may seem perfectly fine until they talk about what they are really thinking. Um, it means schizophrenia always making delusion. Delusion here, the patient has false belief of persecution, guilt and grandeur. They may feel things are being controlled from outside. It is not uncommon for people with schizophrenia to describe plots against them. They may think they have extraordinary powers and gifts. Some patients with schizophrenia might hide in order to protect themselves from an imagined persecution. Um, Here, there are several different types of schizophrenia, each with its own defining characteristic. The first is paranoid schizophrenia. Paranoid schizophrenia, in which a person feels extremely suspicious, persecuted, or grandiose, or experiences a combination of these emotions. Here, paranoid schizophrenia always experience a combination of this emotion. Uh, uh, they can control their emotion. They are combined. They always combine their emotion. Like before, they have a bad mood, and then their emotion. And then their emotion uh, uh, directly good mood, in a good mood. It is paranoid schizophrenia. And then disorganized schizophrenia. Here, disorganized schizophrenia, in which a person is often incoherent but might not have delusion. Disorganized schizophrenia, they do not have a delusion. They do not have a delusion, but they often incoherent. The third is catatonic schizophrenia. Catatonic schizophrenia, in which a person is withdrawn, mute, and negative, and often assumes very unusual postures. The last is residual schizophrenia. Residual schizophrenia, in which a person is no longer delusions or hallucinating, but has no motivation or interest in life. These symptoms can be most devastating. Residual schizophrenia in here, it is very dangerous because they have not delusions or hallucinating, but uh, they have no motivation or interest in life. uh, I think some people that have schizophrenia, that have residual schizophrenia, always want to make their self to die. uh, Maybe I think it is very uh, dangerous, because they have no interest in life. Okay. You have to know the symptoms of schizophrenia. There are four symptoms of schizophrenia. The first is positive symptoms. The second is negative symptoms, and then cognitive symptoms and emotional symptoms. Positive symptoms, also known as psychotic symptoms. These are symptoms that appear which people without schizophrenia do not have. For example, delusion. And then negative symptoms. These refer to elements that are taken away from the individual, loss or absence of normal traits or abilities that people without schizophrenia normally have. For example, blunted emotions. And then cognitive symptoms. These are symptoms within the person's thought processes. They may be positive or negative symptoms. For example, poor concentration is a negative symptoms. And then emotional symptoms. These are symptoms within the person's feeling. They are usually negative symptoms such as blunted emotions. And then we continue to the next slide, is depressions. Okay, depressions is a soul depressed. Uh, it is described as a feeling sad, blue, unhappy, miserable, or down in the dumps, and feeling this way in one time or another for short period. The next slide is about several forms of depressive disorders. The first is major depressive disorders or major depressions. The second is dysthymic disorders or dysthymia. The third is minor depressions. And the last is bipolar disorders or manic depressive illness. Okay, and the last material is about social anxiety disorder. Social anxiety disorders is about social phobia. It is a condition characterized by excessive self-consciousness that goes beyond common shyness. It means that social anxiety disorders, that someone, it is a people, it is a person that 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 their characteristic is not like is not like a human. It is not like a human, a general people, like that. And then there are there are two cases in here. I want to explain you. The first is Kamala and Amala. uh, Kamala and Amala live with wolves. uh, you can imagine how the people can live with the wolves. Their arms and legs short, and then they are no interest in interacting with human. and then their sense of smell was sharp like a wolf's, and they ate nothing but raw meat. Like a wolves always raw meat. And then uh, they died of kidney failure in 2009. Kamala and Amala was very was very wonderful, because uh, they were people, they were a human, but uh, they live in a forest with a wolves, so their characteristic and their body like a wolves. But the first time it is they are a human. And then Jenny case. Jenny is 13 years locked inside a small room. Jenny is trapped to her potty chair. And then Jenny's father had voice anymore. Maybe Jenny's father is a mad person. So Jenny always locked inside a small room. And then discovered in 1970. uh, Jenny came to Children's Hospital in Los Angeles. I think that's all of my presentation, of my explanation. I hope you can understand about my presentations. I think that's all. Thank you very much for your attention. Assalamualaikum warahmatullahi